Amanda here with StraightSmile Solutions, and I'm really excited to talk to you a little bit more about intraoral scanners today. I'm so jazzed up after going to Chicago midwinter, seeing, touching, feeling all these intraoral scanners, and really understanding a little bit more about the ROI and the why behind them. I think people see these big price tags and they get kind of scared. But first of all, right off the top, I can tell you that you can get a great intraoral scanner, sometimes for free if you're doing like a lot of lab work with a certain lab. Sometimes you can lease it for less than $500 a month. And the ROI on these is just ridiculous. It really is if you're using it efficiently. So first of all, scanning takes just a few minutes. Once you get your skill set up, of course, what I really think you should do is I think that you should try all kinds of scanners at a trade show. You should try it out yourself, not just watch their demo, because these people are really good at it. All kinds of things, and you can check my other blog pieces on it that you need to look into. You got to think about what you're using it for, what kind of patient you're using it for. Obviously, if you're using it on a PETA or an elderly patient, you need to have something that's really small, really petite, really comfortable. The edges are comfortable. And if you're doing scans for full arches, for either dentures or for like aligners, it's different than if you're just doing a single tooth. So all kinds of things to think about, right? Of course, the presentation is big. If you're using it as a case presentation, you need to have a nice, pretty color image. If you're not, then maybe it doesn't matter so much. But do check out my other blog pieces, my other YouTube videos on that. But in any case, I just want to tell you how I recommend using it. And all my doctors, they turn a profit on this in I say just 90 days. You're already going to be in the black in just 90 days if you're using it efficiently. I strongly suggest, along with intraoral and extraoral photography and videography, that you take a scan on every single patient that comes in your office. Just takes a few minutes. It's totally non-invasive. It's a great record just to have, for risk management. But also, it's kind of like an insurance policy. Like, you can even let the patients know, and this is a great follow-up, hey, I stored your image of your teeth in the cloud. So, for the next couple months or whatever you need, if you need a new retainer, you need a bite guard, a night guard, whatever you need, a lot of these things that are just removable appliances, we can go ahead and just send that to you. We can just send it to you. You don't have to come back in and get another impression. How would you like to have this? All it takes is a few of these every month and you're already starting to pay this thing off. So what a great way to go ahead and service your patients. So just one idea right off the top, and I can think of like 20 other ideas that you can use it for. But I'll bet you if you followed up with your patients and offered them that, retainers, retainer packages, hey, you can even fabricate bonded retainers. You can have them custom printed, custom cast, custom fit. So many things that you can do for this patient. And sometimes when they're in the office, they feel a little bit pressured or they're in a hurry and they're not really thinking about all the opportunities and all the great things you can do for their mouth, for the stability of their mouth. Hey, you can even start making aligners, without even having them have to come back again, assuming you've taken photos and an intraoral scan. So you can go ahead and start that case. Maybe they're not thinking about it, but if you take pictures or a scan and you can call them up later in a week or two and just say, hey, by the way, I noticed this crowding that's there, or I noticed these abfractions, I noticed this attrition. Looks like it's getting worse. I took some time to really look over your records and, gosh, it sounds like it would be a good idea to do some express aligners. Let's get this moving. By the way, guess what? You don't even have to come in again. I can go ahead and already start making them. Matter of fact, if you want, I've already done an exam. I can mail them to you. I'll mail the first 5 to you. It sounds great, right? I already did an exam. I already did an oral cancer screen. You're already perio healthy. Let's go ahead, no problem. A lot of aligners you can do, as you can do without attachments. So, no reason. You can go ahead and get started. So anyways, hopefully that just gave you some great ideas. If you're interested in some referrals to some great low cost, high quality scanning companies, let me know. I can probably hook you up with a pretty decent discount with some of my trusted partners. So do visit StraightSmileSolutions.com. All right. Thanks so much. Bye-bye.